The MARE study, the purpose was to determine the burden of arrhythmias in a very specific group of patients, which were those who developed new-onset persistent left bundle branch block, a conduction disturbance, following TAVR procedure, transcatheter aortic valve replacement. And the idea was to determine the global arrhythmic burden and then to determine specifically the arrhythmias leading to a treatment change in these patients, and also the rate of advanced or high degree atrioventricular block in these patients. There has been a lot of controversy about how to manage these patients. Even there have been some proposals of preventive pacemaker by some centers. Others say you don't have to follow these patients very close, meaning that there is a lot of doubts and uncertainties about what to do exactly with the management of these patients, and this is a relatively frequent problem. The left bundle branch block occurs in around 25% of the patients and having TAVR. This is one of the implantable loop recorders that are available. It's probably one of the smallest ones, if not the smallest one, and it can be implanted subcutaneously around the fifth intercostal space. And this monitor allows you to record cardiac events, either triggered by the patient because it's symptomatic or automatically. You predetermine that the device records an ECG when it detects an arrhythmia, a tachy or a bradyarrhythmia. And there is a wireless transmission of this ECG data daily from the device to a centralized computer where you can read the events, and then if there is an alert, because there is either a significant bloody or tachyarrhythmic event, then it can be an alert, and then you can talk to the patient and determine whether or not the patient requires a treatment. This device is implanted, and the longevity is up to 3 years. The patient population, these are patients who had TAVR, either with the core valve evolutar system or with the SAPIEN XT, SAPIEN 3 valve system, which are the two most commonly used nowadays worldwide. And in those patients who develop a left bundle branch block that persisted after the procedure, these patients had the device implanted. This is really the population, is a group of patients that we see routinely in daily practice. The main findings of the study is that we detected a high rate of arrhythmic events, a high number of arrhythmic events, bradyarrhythmias and tachyarrhythmias, in close to half of the patients. When you focus on bradyarrhythmic events, these occurred in 1/5 of the patients, and more than half of them were atrioventricular block. When you look at the tachyarrhythmic events, there were a higher number, more than 1,000 events overall, and these events occurred again in about 1/5 of the population, mainly atrial fibrillation episodes in patients without a known history of atrial fibrillation. The limitations is mainly sample size. We enrolled 103 patients. Is a very specific group of patients, but in order to determine the factors predicting the events, especially bradyarrhythmias, we will need to extend the study to have more patients, more events, and then trying to determine which are the patients at highest risk for events. Now I see MARE like more a descriptive study that is the first one looking at this continuous ECG recording in this specific group of patients. There are others ongoing, And I think that with this study extended and others, we will increase significantly our knowledge about the arrhythmic burden in this particular and high-risk group of patients. Yes, I think that this study probably supports the use of a close monitoring with an implantable loop recorder in these patients. Meaning that I think that with the results we had, systematic use of a preventive pacemaker in these patients would be excessive. No particular follow-up in these patients. I think that you can miss some important events, sometimes life-threatening. And just in the middle are these loop recorders with no morbidities, no particular issues that can really give to the physicians a lot of information about the rhythmic events, and then you can maybe prevent some events that could be life-threatening by diagnosing them, by an early diagnosis through these loop recorders. I think that this is a nice indication for these type of devices, this specific group of patients.